Okay, so we'll start with what made you come in.
Oh, Dr. Decotiis was previously my primary care physician. Um, my insurance changed for about 3 years. I didn't see her, but I really like her. So when I my coverage changed again, and it was something that I could use, I came back and just for an annual physical.
And what made you sign up for our weight loss program?
Uh, I had been gaining weight over the past few years and also feeling very tired. And in talking with Dr. Dakotas, she mentioned that I'm in that pre diabetic range. So I was kind of, I guess, shocked and scared at the same time. And she said, well, to get your A1C lower, I could prescribe this medication. And it's something that I'm familiar with because I have a family member who also takes that medication, and this person also has diabetes. So I was like, I don't want to start down the diabetes track. If I could prevent it, if I'm in the pre-range, then there's still some opportunity to avoid that whole situation. So I asked Dr. Dakotas, is there anything I could do where I don't have to start taking diabetes medication? I didn't want to have to be dependent on medication for stuff like this. I just wanted to solve the issue. So she said, well, if you lose some weight, and we'll work on changing your diet as well and getting you out of this pre-diabetic range. And I said, sure. What is that? I'm willing to try it. So she mentioned this weight loss program that she conducts. So I was like, okay, yeah, anything to avoid going down the diabetes track, because I've seen it in my family, and I don't want to be reliant on having to refrigerate stuff and just dependent on medication. I think medication is good, but I don't feel like it resolves the issue. I just want to resolve the issue so that there's not further complications because this issue is not resolved. So that's the main reason why.
And what do you think of the HCG diet?
Uh, let's see. It's odd. It's not something I would fathom. um, so it was totally unexpected. But I do think it works really well. In the past, I have lost weight, but I gain it back as soon as I change something. Um, uh, uh, I like how there's a structure to it and a formula to it, and there's science behind it. When I'm trying to do things on my own, I could research and know certain things for myself, but I'm not a doctor and I'm not a dietitian, so I could miss something that has some kind of negative result. Maybe I'm not taking enough vitamins, or um, you know if you're trying to restrict calories, maybe your body's going to be deficient in something because you're restricting something that's important. So I kind of like how with this option, even though you're eating it's about 600 calories a day, you could feel confident that um, Dr. Dakotas and the dietitian on her staff uh, have your back in making sure you're covered with what nutrients or what vitamins, what extra things you need. Um, I would also say, injecting myself with this thing, I was like, well, I wasn't too afraid of it. I'm not too afraid of needles. But uh, I would say I didn't expect it to work as well as it has. It was kind of difficult at first because you miss what you usually eat. I miss the flavors. I'm from the Caribbean, so I like spicy stuff. I like sweet stuff. Bangles and all this stuff. So I had to get used to eating just simply seasoned food. But I would say for the most part, it was very doable, and I'm happy that I encountered it through Dr. Dakotas.
How do you feel about the HCG or the after the program?
Let's see. After the program, so after the program, I was worried because I was like, I lost a good bit of weight in a decently short amount of time, and I was like, can I maintain this? I don't know. Like in the past, when I've done diets, once I changed something, I gained it back. So I was concerned about maintenance. After HCG, I did the transition program, and I was able to maintain my weight on that transition program. I think it fluctuated, maybe it went down a couple pounds, but um, I think overall it was good. I appreciated eggs again and just eating like some stuff I was restricted from eating on HCG. But I think knowing that I could still eat, um, foods with fat in it and not gain weight, I think that was good to see and like demonstrate over that transition period. So, yeah.
Tell us about the IV experience and the heavy metal.
Okay, so IVs. All right. So even though I lost weight, I was still pretty tired. As I mentioned earlier, I saw Dr. Decotiis for my annual physical because I was just feeling really tired. So this fatigue, this is like 2019 now. I think this fatigue has been going on since at least like 2014 or something. And I would do B12 on certain things to try to get energy up, but I wasn't able to do the things that I like. Maybe I could do like one activity a day on the weekend. I couldn't go multiple places. I'll have to rest up before I do stuff. And when I sleep, I would still wake up kind of tired. I wouldn't feel like well rested. So I would say my energy level did improve a bit after losing the weight, but I was still feeling tired, and I was feeling like gravity's pulling on me, and my movements are extra heavy. I didn't feel like light-footed and like energetic. So when I mentioned this to Dr. Dakota, she said, okay, well, let's get you tested for heavy metals. So we did that, and it turns out mercury and arsenic were high. So I did the chelation IV, like 6 treatments to get this excess heavy metals out. And I also did the detox program at that time as well. And I would say maybe the detox is 1 month, and the IVs were 6 treatments over 6 weeks. So I would say over that period of time, coming down to like the second to last week, I started to feel like I had more energy, and it felt like I was living under a blanket for years, and it got lifted, or a veil, like a heavy veil. And now I feel normal. I was like, I haven't felt like normal in years. Like I've always been feeling like there's an extra heaviness, an extra weight. Even if I'm rested, I don't get this feeling of, hey, my energy level is like normal, or after taking a nap or rest, I don't feel like it did anything. So I was happy to see that that seemed to be a solution to the problem, because I don't think nothing else has worked as well over the past few years. So chelation definitely was a big help.
And how do you feel now?
Well, now I feel pretty good. It's nice to know something is working, and it's nice to know also that I have some support and some experts that understand the body well enough to tell me what best action I should take to improve results. So I still have some more weight to lose, but I feel very confident that I could make it there. And I feel like even if I may not understand something, or maybe I have something that's unique to me, that I can talk with Dr. Kodes and her staff and get some kind of customized feedback on that, rather than me just kind of like doing trial and error to figure out stuff. So I appreciate that, and I feel like definitely moving forward I could hit my goal, as long as I put in the effort that I need to put in, and I have the patience to just see it through.